Díobh go léir agus bhar géadfáilte chuig an ócáid seo an tastas digitach COVID an Aontas Orpig. Hello everyone from sunny Dublin. I'd like to warmly welcome you and our panel to this event on the EU Digital COVID Certificate. So this event is hosted in conjunction with the European Parliament's Liaison Office in Dublin here, the European Commission in Ireland and European Movement Ireland. So it's wonderful to have you all here today. My name is Aisling Brady and I'm a broadcaster and producer with Irish Parliamentary Television, Oireachtas TV. I'm based in Leinster House in the heart of Irish politics in Irish Parliament. And hopefully with the assistance of the EU Digital COVID Certificate, I'll be back in Strasbourg soon. Recently, we've all seen a lot in the news about the EU Digital COVID Certificate. So we have our panel here to be able to shed some light on as this certificate will be rolled out across all EU member states. So this certificate, as we've heard the debates in Parliament there, as I was mentioning, this has been in the news a lot recently, and the final vote took place this week, passing with a clear endorsement of 546 votes in favour, 93 opposed and 51 abstentions. So a clear endorsement of this proposal. So the EU Digital COVID Certificate will be launched on the 1st of July across EU member states. Now, I know some EU member states are already rolling this out. In Ireland, we're set to link in on the 19th of July. So this will see the return of non-essential travel. So many families who have members living abroad will be united for the first time in a very, very long time. A lot of businesses will be able to get back up and travel again for business purposes. And of course, we'll see the return of the travel and tourism sector, which is vital for the recovery of the EU economy. So we have a large audience here today. So I'd invite you all to submit your questions. We'd be delighted to hear from you if you have any questions. You can submit them to events@europeanmovement.ie. Now, I think there's a scroller coming up on screen there for you all to see. And we'd like to encourage you all to tweet as well about this event and get some traction. So don't forget to use the hashtag EU COVID Certificate. And when tweeting, posting or sharing, make sure you use the handles EP in Ireland, which is the European Parliament in Ireland, Euro Ireland, which is the European Commission in Ireland, and EMI Ireland, which is the European Movement Ireland. And don't forget to tag our panelists here too. So on that note, joining us to discuss the EU Digital COVID Certificate, we are in the company of, first of all, I'd like to introduce Monika Mosshammer, who is Deputy Head of the Unit for Union Citizenship Rights and Free Movement. She's also Director General for Justice and Consumers at the European Commission. Her unit has been responsible for the EU Digital COVID Certificate proposal adopted by the Commission in March, which we know the Council and the European Parliament has later approved. And we also have Sophia, an MEP from the Renew Group, a Dutch MEP from the Netherlands. We're delighted to have her here. And she is Shadow Rapporteur on the EU Digital COVID Certificate Legislative Report for the Renew Group. So we're delighted to have her here as well. We also have Irish MEPs, Billy Kelleher, who is also from the Renew Group, who represents the Ireland South constituency. And we have Deirdre Clune, MEP with the European People's Party, who is also from the Ireland South constituency. So you're both very welcome. And I'm delighted to also invite Minister Ossian Smyth, who is a Minister of State with responsibility for public procurement and e-government at the Department of Public Expenditure and Reform. So we're delighted to have you here and you're all very welcome. So first of all, I'd like to invite Monika to make her opening statement on the EU Digital COVID Certificate.
Thank you very much, Aisling, and good morning or midday to Dublin. Yes, I just wanted to present you quickly what we have done since the beginning of the crisis, because we are all aware of the restrictions imposed by member states for public health reasons. Member states can restrict free movement for that reasons, but of course they should remain proportionate and non-discriminatory. Last summer or end of spring, we saw an improvement of the situation and member states took back the restrictions, but throughout the summer the situation situation got worse, which then led the Commission to propose a Council recommendation on introducing a coordinated approach. And I wanted to add that before we go to the DCC, because there is a parallel development that needs to be taken into account in this respect. So in October, the Council then adopted this recommendation introducing MEPs, green, orange, and red, and measures that can be taken on travellers coming from these regions. These measures range from quarantine to testing, and of course, member states wanted to have a proof for that. And then we realized that there is no harmonized format for that, and there were also falsifications around. So member states did not really trust that the certificates issued by other member states would be issued to a person which indeed has been vaccinated, recovered, or tested. And that's the reason why we then in March, on the 17th, adopted the proposal for the digital COVID certificate, as it is called now, and not any longer digital green certificate. If I still use the old word, please forgive it, but it was a bit of intense negotiations the last 2.5 months, so I might have been brainwashed by the name as well. So, but what have we done with the digital green certificate? It encompasses 3 different certificates, namely a vaccination certificate, a recovery certificate, and a test certificate. And what we have laid down, that if a member state waives restrictions on travellers holding such certificates, they should also waive it for holders of certificates issued for third countries. That's very important, because then we have the non-discrimination between our citizens, but we also considered it to have the tests on the same footing as the vaccines and the recovery certificate, so that you have the right to get it, and also the right to get in a digital format and a paper format, so that we do not discriminate against vaccinated people. The acceptance of such certificates is for the member states to decide. But as I said, if they accept a certificate, they should also accept it from should also lift the restrictions for holders of certificates issued by other member states. On the details for the vaccination certificate, member states are obliged to accept vaccines that have been EMA approved from the European Medicine Agency, but they are not obliged to accept others. As far as tests are concerned, we've included rapid antigen tests and PCR tests, and recovery tests are based on PCR tests only. And after the 11th day, you will then be able to get a certificate to show that you have recovered. How does the system work? We have established a gateway through which public keys are exchanged. So the person issuing a certificate will issue it with a private signature, and then through the exchange of public keys on the other side, the verifier can see whether indeed, by using that public key, whether the document has been issued by an authentic person. This is very important, because that allows us not to exchange data via the EU Health Gateway, which was also an important point for the Parliament, but I suppose Mrs. Inetfeld will elaborate a little bit further on that. What was also the outcome of the negotiations, that while member states retain the possibility to impose restrictions for public health reasons, they should refrain from adding additional restrictions to holders of vaccination certificates and recovery certificates, unless in a case of an emergency there is a new variant of concern. The Commission also committed to make 100 million euro available to the member states in order to support them to provide for affordable tests for citizens, because that is, of course, always a tricky issue. While the certificate as such is free of charge, the underlying tests not necessarily are free. Some member states do issue them free of charge, others don't. And it was very important for the Parliament, and we were happy to take it up to support member states to provide for affordable tests, in particular for those persons crossing the border on a regular basis. And you mentioned, yes, it was adopted yesterday, approved by the Parliament with 549 votes in favor, which we very much appreciated. The Council will adopt tomorrow, I think. So signature can then take place early next week. And in parallel, we've also worked on the famous recommendations that I mentioned in the beginning, which should lead to waiving restrictions for all vaccinated persons and persons who are in possession of the recovery certificate. With these recommendations, also the thresholds for coloring the different regions will be slightly changed, because we think that with the vaccination improving in all member states, the situation is getting better, so that we increase the thresholds, that more people coming from a green or orange region can then also travel easily.
Monika, I'm interrupting.
I just wanted to say that's my overview, and sorry for having taken so much time.
You're only 1 minute over, don't worry. So, but we will come back to all the issues that you addressed in your opening statement. So thank you very much. So next, we are going to welcome Sophia into Veld to make her opening statement.
Okay, thank you very much, and hello Dublin from Strasbourg. I am particularly personally pleased that we are making progress with this certificate, that it has been adopted, because I can tell you, traveling from Belgium, Brussels to Strasbourg in France, back to Belgium and then to the Netherlands is impossible to, it's impossible to figure out what to do, which rules to follow, etc. So I'm very pleased. I'm also very proud that the European Parliament has adopted this not only in record time. We have worked very fast, but as the figures show, it was also, there was very, very broad consensus amongst all the political groups. It has really been endorsed by the vast majority of all the political groups from left to right in the European Parliament, and that is a good thing. However, the negotiations with the Council, i.e. the Member States, have been incredibly tough, and there are still things in the outcome that we are a bit unhappy about. And we're going to see how it's going to work out in practice. Parliament had two major priorities. One was, we want to end this impossible patchwork, this almost, it's a spaghetti of rules and restrictions and regulations that nobody can follow. We feel that if you have a certificate, that should really be, what gives you freedom to travel. The second thing is, because there are the three certificates, so vaccination-based, recovery-based, or test-based, we felt that there should not be any discrimination between the three. And as vaccination is free in all member states, we felt testing should also be free, testing for the purpose of the certificate. I'm afraid on both issues we've not fully achieved what we wanted. It is really remarkable to see how member state governments were really more attached to preserving their prerogatives to take measures, to take national measures, rather than making it possible for citizens to travel carefree. And I think I would like to remind everybody, every European citizen has the right to free movement. That right has not disappeared because of COVID. So, and this certificate is only necessary because the member states, even if, as Mrs. Mosshammer said, the member states in principle have agreed on a common COVID map of Europe, in practice, they're all applying different rules and different norms and changing the rules the whole time. We wanted to end that, and that did not fully succeed. Are the member states now going to try and stick more to these common standards, the common guidelines? I very much hope so, because I think that citizens need it. And this is not just for holidays. This is also for people who travel for work, who travel for family purposes, people who on the mainland, you know, live in border areas and they have to shuttle across the border the whole time for work, school, groceries, living, etc. As to the free tests, there too, the council, the member states did not want to agree. However, we did secure an additional 100 million euros in funding to make free tests available to people who need it most. And we are currently working on raising that amount even more. And that is, of course, on top of the free tests which are being made available in some of the member states, like in France, where all testing is free. So in conclusion, I think this certificate is really going to be a great help in regaining our freedom and our right to free movement. But a lot depends on how the member states are going to apply it, when they will introduce it, and if indeed they're going to refrain from additional and basically unnecessary national restrictions, but if they will all use the same roadmap, the same COVID map, quite literally, and make it as easy as possible for the citizens. So having said that, I would like to wish everybody already a very good summer.
Thank you, Sophie. So next we are going to have Billy Kelleher with his opening statement on the EU Digital COVID Certificate.
Thanks very much, Aisling. Also, greetings from Strasbourg. I think I'm just opposite Sophie here in the corridor, actually. But just to say that, you know, even getting to Strasbourg from Strasbourg as an Irish citizen is quite difficult. It's quite onerous. It's not a complaint. It's just the observation of the fact that you have to fill in so many forms. There's limited flight options. All of this is because of the COVID pandemic itself. So we first and foremost have to acknowledge that we are in a public health emergency. The basic measures that were put in place by countries over the last year plus were there to save lives, reduce the spread of the virus itself. But now we have come to a stage where, you know, we see the rollout of vaccines across the continent. It is having a profound impact on the numbers of people who are contracting the disease, but also ending up in hospitals. In other words, there's a major COVID bonus now happening across the continent, and that's very welcome. Even in the context of Ireland itself, I mean, some of the largest hospitals have now reported that they have no COVID patients in their hospitals, and that is an indication that we really now are at the cusp of something that's exciting in terms of opening up our economies, getting people back to normal business, getting families connected, and making sure that business and commerce and trade can operate across the continent. And Sophie referenced a very important point. I mean, the first is that all countries and governments are obliged to try and protect their citizens in terms of the public health emergency that was there. But equally, there's another very important right, and that's the right to free movement, and, you know, the right to travel and to be able to move freely across the European Union. And that is an inalienable right that can't be just undermined very, very easily. And I do think that because of where we are, the public health measures, the vaccination program, the dropping number and in hospitals is an indication that we can now embrace the digital COVID certificate. And I was a proponent of this for a long time, so I always felt that there needed to be a harmonised approach across the continent. And the reason being, I witnessed myself firsthand at airports, the chaos that, you know, people were presenting documents. Very often they were printed off, no way of making sure they were genuine, how you could authenticate them. There was obviously forgeries, and you know, you'd see people presenting screenshots at boarding gates, etc. So there was no uniform way of ensuring that any document that was presented was authentic. It either was a vaccine certificate, it was a recovery certificate, or it was a test certificate. And I do welcome what has been announced. From an Irish perspective, let's be very honest. I mean, you know, the 19th of July is the day that we have decided that we're going to embrace that concept. And I hope and I think this is very important, that it is for all citizens, not just people who want to come into the country, but that there is a quid pro quo, people wanting to travel from Ireland out as well. That we don't have any additional barriers for people wanting to leave or people coming in. That we treat every European citizen in a uniform, fair and equitable manner. So from that perspective, I sincerely hope that we can embrace the technology, number one, get it up and running, and that we can then enter into the spirit of it. In other words, that we treat all European citizens
okay,
equally.
thank you.
And there's an emergency brake mechanism. So yeah, I just want to say there is an emergency brake situation in place, whereby in the event of an epidemiological change with the virus, that countries can address it as well. So that's an important point as well. So look, overall, I very much welcome it.
Yeah.
Thank you very much.
Billy. So I'm just conscious that we get some time to ask our panelists questions. So now I would like to invite Deirdre Clune, MEP with the European People's Party, to make her statement. And is the line freezing there for us?
Can you? I hope I'm having. Can you hear me?
Deirdre, can you hear us?
Oh yeah, I mean you're back now. Yeah, I hope you can hear me. Sorry.
We can hear you now. Yeah.
I can hear you perfectly. Yes. Okay to go. Thank you. Sorry, I had a perfect connection earlier on, but now anyway. Listen, thanks thank you, and thanks for the opportunity to be here and to share all the information for Monika and to Sophie. Thank you for your work that you've done. I know it hasn't been easy at some point, but I think from the moment the Parliament voted that we wanted to fast track this initiative and we would give it our almost 100% support, I think we have been it's been very effective and things have moved. So we're at the point now where there's a high expectation there from citizens that this certificate will be available to them. For those who want to travel, absolutely, it's very important for people who, from families who haven't seen family members, who haven't been able to just sit down around a table with their families for over 15 months now, and it is quite. When you step back, when you think about it, it is a very, very difficult situation for them. So I think we have to bear that in mind as well. It's very important. So we're at the point now where we're going to have to. Parliament has agreed we want to strike a balance, recognising that the balance has to be struck between what member states in terms of protecting the health of their citizens, watching the epidemiological situation as it may advance in some cases and may not, and so that balance is there now, and trying to integrate the traffic light system, hopefully, with the certificate. But for all the reasons that the previous speakers have said, I'm very much welcome and supportive. We need to make it easier to travel now, and as we've seen, like up to 50% of European citizens have had their first dose of their vaccine. So we're in a very different situation than we were at the beginning of this year, and that's very positive, and we can see it in the numbers in hospital cases reducing all the time, and that to me has always been a very strong measure. So I again would like to repeat the chaos the potential chaos at our airports. You've seen it with the testing certs. I've seen a couple of times I've been asked for my obviously all the time for your PCR test within 72 days, but then some airlines and some airports will want to see your actual appointment to verify that the test result you have isn't a forgery. Now, so that's what's out. That's potentially what's out there. The same with vaccines. So we need something that has this QR code that is authenticated and can be used to get people to facilitate easier movement through our airports. Because at the moment, now airlines won't give a boarding pass beforehand. You have to present yourself at the airport, which I can understand. But so something as simple, if you like, as this certificate on your phone or on your hand with the QR code can make an enormous difference. So we tread cautiously, tread carefully. I know from airlines, looking at airlines and what they're expecting maybe this month to be 50% of their 2019 levels. Is not quite the same for Ireland, but across Europe, Eurocontrol figures would state about 50% of levels of 2019 in July, expecting it to actually go up to 70, almost 80% in some cases. So So that is encouraging, and I know the European Centre for Disease Control and EASA, the European Air Safety Association, are preparing revised guidelines now that they're going to produce 15th of June, which is next week, on how to make our airports safe, how to move forward in terms of safe travel, social distancing, hygiene, and what passengers can expect when they're travelling through the airports and indeed on aircraft. So those standards will be very important, and it's good to see the two bodies, the European Centre for Disease Control and EASA, working together on that. They did so previously last year, but I mean, we all know how little travel there was last year. So I mean, I'm not going to repeat everything that's been said already. I think it's a positive move. I think particularly we're going to see for in Ireland. I look forward to getting engagement with other member states outside the European Union. In particular, I'm thinking of the United Kingdom and the US, which would have a lot of travel in this country, to ensure the certificate that we have developed in Europe that can be recognised, and vice versa, because we do have a lot of travel, a lot of families who want to communicate from those two jurisdictions. So on the whole, positive. I look forward to the member states now hopefully agreeing or recognising that there will be different approaches in different countries, and we have to tread cautiously and strike that balance at this point. So thank you, Ashley.
Thank you very much, Deirdre. Thank you for that opening statement. And now we are going to move to the Minister, who is going to give his opening address. I think people are keenly anticipating details on how this is going to be rolled out in Ireland.
Hello, everybody. It's great to be here, and thank you for inviting me to speak at this. It's interesting that there are different aspects to this. There's a transport aspect, and then there's a health aspect, there's a European aspect, and it's good to have different people from those different perspectives here together. My perspective is that I'm an engineer, so I'm looking at this in the classic idea of what is the problem and what is the solution. So the problem that we have is free movement. People are not able to move easily around Europe, and the knock-on consequence of that is a loss of free movement, a loss of connectivity in Europe, and also damage to the tourism industry. So what's causing that, and how do we fix it? So the cause, and this has been alluded to by other speakers, which isn't often talked about, is that people are arriving at European airports with pieces of paper that say that they're vaccinated or say they've been tested. And it's very hard to determine if those pieces of paper or those screenshots on phones are authentic, are they valid? It's very easy to knock up an A4 sheet of paper, buy one on the internet, or you can make something in Microsoft Paint and stick it on your phone and turn up, and there's no way really to validate it. And part of the problem is the length of time it takes to validate these different documents. So people arrive at an airport, and typically one of the stages you go through is that somebody has to authenticate your passport. And there's a place, there's a mechanism, there's equipment, there's a standard for passports, and it is possible to determine whether a passport is genuine or not and whether it attaches to that person. We don't have that infrastructure for determining whether somebody has really passed a COVID test or whether somebody is really vaccinated. And you can imagine somebody can show up from anywhere in the world. They've got a piece of paper saying that they went to some particular test lab or some particular vaccination center, perhaps privately run, and that they're okay. How do we trust that? And because of that lack of trust, that then translates into member states imposing very strict rules on travel. So it's the lack of trust that leads to the restrictions, and it also leads to inefficiency. And inefficiency in an airport is not so bad when you are only running at 5 or 10% of normal passenger levels. But what happens when we return to the type of volumes of passengers that we had in previous years? They're simply not going to get through the airport in that time. And secondly, there is a problem with the risk of infection when you have thousands of people crowded into an airport, unhappy, waiting to get through because it's taking so long to check all their various documents. So the idea of these certificates is that you have a mutually recognized and acceptable document which can be scanned quickly. So you arrive at a counter, there's a QR code in the corner, somebody scans it, it goes beep, green, you can go through. So that we get the efficiency, but also it's a digital signature. So it's using public key encryption. There's a private key and a public key. We know that that's a genuine document that has been signed by an authority that we trust. In other words, a member state has signed it, and that government is guaranteeing that that person has been vaccinated or has been tested or has recovered from COVID. So that's what the proposed solution is. and it's just important to just keep a focus on that, on what we're trying to do. So in January, in Ireland, the HSE developed its own in-house vaccination certificate system. They started issuing vaccination certificates to a pilot group of HSE staff, and they've been doing that since. So we had something to work on until the European proposed digital COVID cert specifications were produced. And since then, we've been adapting what we've done to what's required. So we've got two real challenges here. One is technical, so just issuing the certs is one thing, and that's absolutely fine. The second problem is policy. So once you've got one of these certificates, is somebody going to accept it at the other end? Where are they going to check it? What are the rules going to be? So what these certificates say is, they say when you got a vaccine dose, which vaccine you got, or else they say which tests you've had and when you had them. It doesn't say whether somebody is going to let you in with this particular document. In other words, it's not a travel document. It's not a guarantee that you're going to be admitted. And every country was allowed, certainly at the start, every country was told that they could set their own individual policies on admission. So every country can determine what's their threshold for admitting somebody. Now, I think we're moving now towards, if you're vaccinated, you can be admitted, which certainly seems to make sense. But we're in an evolving policy area between now, 1st of July, and our target date, the 19th of July, where those rules are changing, and they're changing according to the changing risk that's happening. So to give you an example, a topic that's been much in the media is antigen testing. The specification for these, so there are two aspects to an antigen test. There's whether we're technically going to include it on a COVID cert, and then whether it will be accepted by the other government at the other end, at the receiving airport. So the specification says antigen tests can go on. Particular types of antigen tests can be included in the certificate, so they will be. But you might arrive at a country that doesn't accept those antigen tests as being possible to travel. So it is still a complex situation, and it is a challenge. There's also questions began to arise about civil rights. Will these vaccination certs be used to prevent you from going about your normal business? In other words, go to a restaurant, and we clearly laid down policy at the start that we wouldn't do that it would be for travel. Last week, I met transport ministers last Thursday at the Council of Ministers, and I discussed this both in a group and with individual ministers about the various challenges that were there. And one of the things I got to see was what it's like going through an airport in practice, and it is very inefficient. Going through an airport, there are a lot of people queuing up, and the process of checking the certificates is not. It doesn't look like it's very thorough. There is another issue that arises is what happens when somebody tests positive when they're abroad. How will they come home, particularly on a family holiday? If a group is away on a family holiday and one of the children tests positive before they leave, how are they going to isolate? That needs a sort of an insurance solution. So we have three types of certificate referred to. We've got vaccination certificates, and I'll just give you some information about how we're getting on with them. Initially, vaccination certificates are clearly the most important of them all because they're the longest lasting. After that, recovery certificates, which will last for a period of months, and test certs. And test certificates are very ephemeral. They only last for that couple of days before you arrive in. So they don't really have much value. A test cert from a month ago really doesn't have much value. So with vaccination certs, we're ready at the moment to issue 1 million vaccination certs, which are those that went through our vaccination registration portal. We have another 1.3 million that would be issued based on data from GPs. In terms of recovery certificates, about 250,000 people on our system we have recorded as having recovered from COVID in the last 9 months. So that's another 250,000 that we could issue right away. And for the test certificates, we are working with individual laboratories to accredit those laboratories and to set up data feeds so that when they test somebody, those test results can come in and be used as a signed certificate for people to travel. So the system is being developed in-house. The work has mostly been done by the HSE. It's in coordination with my staff in the Office of Government Chief Information Officer, and there's a senior officials group under the Taoiseach's department that's coordinating between other departments around the government, because of course health is involved, and of course tourism is involved and transport is involved. So thank you very much, everybody. Thank you.
Thank you very much, Minister. So, Minister, I have a number of questions for you to start with. So, for people for attendees who are watching today, so say they book their flight, for example, to France, to Spain, they're going on business or they're engaging in tourism. How is the system going to work, and where will they receive their certificate from?
So your certificate will be, well, for the start, our go live date is the 19th of July. So so any travel before then, you're not going to be able to get a certificate before that date. So you have the government will issue your certificate based on the records they have of your vaccination. We had obviously a ransomware attack on the HSE. A lot of systems were disabled or slowed down. But luckily, the vaccination system was on the cloud, very recently developed, and survived unhurt. But it has delayed some of the feeds into GPs and so on. So what will happen is that your cert will be issued to you by email, and will be available for you to either to download, or you can opt to have it printed out and posted to your address. Now the question is, will it be this? We can issue you with a cert, but will it be accepted at the other end? And that's really the big question. And what will the rules be for the country that you're planning to visit? I think you gave Germany as an example. So let's say you're planning to go to Germany in August. What will the rules be on admission to Germany in August? And that's really something that's difficult to predict. So there is an element of risk still attached. Okay,
and we'll come back to that question, because we have Sophia and we have Monika here who might be able to shed some light on that. But in terms, so for our citizens or people living in Ireland, and if they're going to book their flight, who do they ask for the cert, or where do they go to get the cert? Like, is it that the HSE will automatically issue this, or what are the practical steps to actually go and avail of a cert?
So the HSE has the email addresses. They have better data on the people who registered through the portal than they do on the people who registered through GPs. We do have everybody's contact details through GPs, of course, but we actually have email address and SMS data, phone numbers for everybody who registered through the portal. So we can instantly contact 1 million people by email and offer them their certificate. Say to them, you were vaccinated. You are eligible for a certificate on your phone, and you can opt to have it posted out to you. So they will all be offered it. There's no cost to the issuance of these certs.
Okay, and so for the likes of people who've been vaccinated, or say for people who have received a negative PCR test, or people who are not vaccinated, how will it work for them?
So if you're not vaccinated, how does it work? Is that your question? Yeah. So yeah. If you're not vaccinated, next question is, have you recovered from COVID in the last 9 months? If you haven't, and if you haven't, then the question is then your last option is to get tested. And to get tested, you need to go to an approved testing operation, one of the laboratories that is accredited by the state, which will be listed on the HSE's website. You go along to them, you get tested within the 72 hours of your flight, and you get issued with a certificate, which is emailed out to you or posted to you as you prefer, for you to use on your travel.
And the question of PCR tests and the cost of PCR tests, that has come up. I understand that the EU are allocating 100 million fund. Do we know if that's going to be available to Irish people wishing to go abroad to reduce the cost of PCR tests?
Yeah, I saw that news. I think it's very welcome, and I guess it's a reaction to the fact that that PCR tests are expensive, and particularly if you're bringing a family and you've got children who can't be vaccinated because of their age. So vaccination is not permitted below certain ages. The drugs are simply not authorized for that age. So in practice, children have to be tested, and if each test costs €100, then you're into a very difficult situation where it becomes too expensive to travel. So it is a real problem. The policy at the moment is that the state is not going to pay for the PCR tests, and that you'll have to be privately tested. But I do note that this announcement of 100 million to subsidise those costs, and we'll certainly be engaging to find out. I'm sure we're entitled to a share of it, and to see what the mechanism is for that. and how we would operate that and how we can subsidize tests.
And just 2 more questions before I bring in other panelists. So once the 19th of July, once we hit the 19th of July, restrictions such as fines or mandatory hotel quarantine will obviously go. But for Northern Irish citizens, what's the case for them? Will they be able to opt into this system if they wish to do so?
So there are ongoing intense negotiations with the UK over travel. I mean, I think we had originally hoped we could get a travel bubble with the UK, which would to get the common travel area working again. And I think that was delayed by concerns about the Delta variant. But I know that the UK is looking at a very similar system to the DCC, to the digital COVID cert, and is working directly with the EU, and I believe in a very cooperative and productive way. So I think that it's absolutely within, certainly British people do like to travel around Europe traditionally, and I think that they are going to want the same freedoms that the rest of us have to move around, and it is in their interest to arrive at a system which is very similar and mutually acceptable. So I think that's the direction we're going. But it is, sorry, one other detail I give on this is that if you travel, if you think about this, if you travel to another country and you're not vaccinated and you want to get a test cert to come home again, you're going to have to apply for a test cert from the country in which you're in. So you're going to have to get a test. So in other words, member states are going to have to issue test certs to non-citizens as well as their own citizens, and they're going to have to. Which is a complication because they don't have ID information on foreign citizens. And in fact, if anybody from the panel who's has thought a little bit more about that's going to be complex. So you're coming home from your holiday in Portugal to Ireland, and you need to get your test cert from the Portuguese authorities, which is another step again. So it adds to the complexity.
So actually, just picking up on that point, and we touched on it earlier. You know, if, say, for example, and I'm going to put this to Sophia, as I know Sophia is keen to come in, and you have been across this and following all the negotiations very closely. So if, for example, you're in Ireland and you're traveling from Ireland to Portugal or France or wherever it may be in the EU, you know, how much of a guarantee can you give to people that I suppose the system will be, I suppose, a similar approach across all member states, and that it's straightforward, that once you arrive in another member state, that you'll be able to return quite seamlessly, which I suppose is what the aim of the EU digital COVID certificate is.
Well, that's what we wanted to achieve, that you can travel seamlessly. It may well be the case if member states are of goodwill, but I think one of the important things that the minister said at the start is that this whole situation has arisen not as a result of the virus, but as a result of lack of trust between the member states and lack of, let's say, interoperability and no, mutual recognition. That's the real problem. If you look at the United States, they have everything we have. They have vaccination, they have testing, they have mouth masks, they have lockdowns, they have quarantines, they have self-isolation, they have everything. The one thing they don't have is actual, you don't need a certificate to travel across the United States. The only reason we need this certificate is because the member states do not have the same approach, and they actually refuse to take the same approach. That is the real problem. So we're trying to solve a problem which has been created not by the virus, but by the lack of coordination and harmonization between the member states. So yes, there will still be a lot of questions. I think the one problem that the certificate solves is, I think Billy described it earlier, is when you get to, for example, the airport or whatever, you cross the border, that if you have the certificate, that it will be recognized. They're not going to say like, oh, what is this piece of paper? Ireland, we don't know this. No, you can't enter. They have to recognize the certificate. So that's a good thing. Member states can still unilaterally impose additional restrictions. And so people still, if they travel, I would always recommend do try and find out what the situation is. Contact people on the spot, because there may still be additional restrictions. I do hope that is going to be
Just
solved.
on that point, I know, sorry to interrupt you there, Sophie, I'm conscious that Billy Kelleher has to go at 1 o'clock, and I know Monika wanted to come in on the whole, I suppose, harmonisation of the process across EU member states, and if you're travelling from one country to another. So Monika, I know you have some points to add to that.
Yeah, thank you very much, Aisling. As Mrs. Inetfeldt just mentioned, it is of course crucial that the information is available on the respective restrictions that are in place. And that was one element that we very much insisted upon during the negotiations, that member states need to give timely information both to citizens but also to stakeholders, airline companies, and so on and so forth. But I would like to come back to the recommendation that I mentioned in my introductory statement, that we hope to be finalized soon and approved by the Council, where indeed for vaccinated people and persons holding a recovery certificates that these restrictions should be lifted. Of course, we are aware we are in the field of the recommendation. Mrs. Inetfeldt also mentioned before, not all member states always apply our recommendations. Yes, we are aware of that risk, but nevertheless, I think we are really moving in the right direction, and moving in the right directions to be able to lift restrictions, because that's what we really want to do, lifting all these restrictions to the free movement, which unfortunately have been introduced based on this virus, but with all the vaccination uptake, we really hope that we are coming back to a situation where we can all enjoy our fundamental right of free movement again. But information is crucial, and before you travel, really always look at the respective websites. And Reopen EU has been created for that particular purpose as well. Thank you very much.
Thank you for that, Monika. And just to bring in Billy Kelleher there. Billy, you mentioned the emergency brake system. I suppose while restrictions are easing now and we're seeing the return of non-essential travel, how important is it that member states can impose an emergency brake, or governments can make decisions to reimpose restrictions? As you know, I suppose with travel, there is still a risk of variants or, you know, a deteriorating situation.
Well, I mean, look, public health must come first and foremost, and we all accept that. So, I mean, it was an issue that, you know, people were concerned about that in the event of there being a variant or there being a major change in the epidemiological situation of a country or a region. Well, then that there would be some opportunity to provide an emergency brake. In other words, they could enforce stricter restrictions. And that is still the case. And I think what is very important, and I think we're going to have to really put a lot of thought into this, and Minister Smyth did point it out, I won't see huge difficulties, I think, in terms of people presenting a vaccine certificate or a recovery certificate. The key issue will be, though, if you go to another country and you either contract COVID-19 or you need to get tested to come back to another country, will you be able to avail of testing in another country? Will it be easily done? Can it be authenticated? These are the key issues. And the other very, very important factor as well, in the event of many people, we'll say, leaving a country and all of a sudden restrictions being imposed, you could have many people discommoded, not being able to return. So we have to have a monitoring of this, and a very, very in-depth monitoring of it, because you could have a situation where many people could be locked out of a country for a period of time after going on good faith with the digital certificate or with this COVID certificate, and then being unable to return because of restrictions being imposed by a member state. And that clearly does require a lot of thought and I think almost independent assessment, rather than member states just making a unilateral decision. It has to be based on the European Centre for Disease Control. It has to be based on other issues just in the member state itself. I would be very, very worried otherwise if it was just down to that particular issue.
And I suppose for a lot of people traveling as well, there may be language barriers if you end up in a member state where maybe English isn't as proficient or whatever it may be. So there are a lot of complexities with this.
Yes, and so, also actually I just think that the other issue of concern would be the exploitation of the cost of PCR testing. If you are going to a country, it's a big tourist country, you go in, the only way you can get out is by having a PCR test. Well, look, if it's just down to the market, you know what will happen. So we have to be very conscious of those issues as well to facilitate travel.
Okay, I'm just conscious of time here, so I'm going to go to some questions. A lot of questions. We've had huge response to this from our panel, so I'm going to just put some questions to Deirdre first. So what is the reason why fully vaccinated passengers from across the UK and Europe have to wait until July 19th, nearly a further 6 weeks to enter the country without quarantine and testing requirements? So I suppose why that delay to the 19th of July rather than like with the rest of EU member states where they're beginning on the 1st of July?
Well, I mean, that's a decision for the Irish government. That's been said. We're going to open up the country for travel. Non-essential travel will start on the 19th of July. Is that, sorry, I just missed it. There was a break up there. Is it for travellers people coming into Ireland or going out?
So what is the reason why fully vaccinated passengers from across the UK and Europe, so if they're coming into Ireland? So I suppose the EU COVID certificate is live from the 1st of July, but we're not entering it until the 19th.
Until the 19th of July, and that's a decision by the Irish government, and that's, I mean, that's what we've been talking about. There are going to be different reactions across different member states. So anyway, Ireland won't have our own. We won't have our own certificate for passengers for travellers leaving Ireland until the 19th, as the minister has just outlined there. So,
and actually, Minister, I'm going to come back to you, and I know you addressed the issue of antigen testing. But is this likely to be accepted in Ireland into the future, or will it just be PCR tests?
So this is and it's the same as the last question. This is the division between the technical issue of certificates and then the policy that goes with them that decides who's allowed into your country or not. So I can give you a certificate that says you've had an antigen test, but will the responding country receive that? Ireland's policy about what restrictions, what level of surety you have to give before you enter is determined by the government on the advice of the Minister for Health, and the Minister for Health is advised by NPHET. So that's what the chain of advice is there. It's absolutely completely separate from digital COVID certs. So if at present you need to have a negative PCR test to enter Ireland, that's for everybody, and that's what the health policy is. In order to change the health policy, the Department of Health and the Minister for Health would have to say that they had determined that, in fact, that the level of risk had reduced to a stage where they didn't need negative PCR tests, that a vaccination cert would be enough, particularly one that was provable, and that and then they would bring that to the government, to the cabinet to agree. That hasn't happened yet, but it's a separate process from COVID certs. Yep. So
PCR tests are the standard, and that's what's going to be required.
So that's what the standard is at the moment, but I see that the policy is rapidly evolving all across Europe, and it's actually hard to keep up with. You want to see which countries are accepting what to enter, and it just adds to the complexity of trying to plan any kind of trip.
And this, Minister, may be another question for you. Ireland currently has laws in place that fines EU citizens €2,000 for non-essential travel to other EU countries. Will this be in contravention of the agreement after July 1st? So will passengers, I suppose, arriving from other EU member states, I suppose, will all those fines or any restrictions, will they be forgone? Will they be removed come July the 1st?
Yeah, so my understanding is that the restrictions on travel, the restrictions on entry to any member state are still a competence of every member state. So every member state is entitled to make its own rules. Now, I may be corrected on that. Maybe there has been a common agreement that vaccination will be accepted after July 1st, and I stand to be corrected. And perhaps Monika might want to come in there.
Can I say something on that?
Sure.
Yes, Sophia, go ahead.
Because this is the whole problem, you see, and Billy also alluded to it. The member states last year, October, have decided or have agreed on a common COVID map. You know, the map with the green and the yellow and the orange and the red. The point is that in practice, the member states do not follow that. They each have their own national recommendations and their national maps. And if at least the member states would accept that the people who are in the ECDC, the European Centre of Disease Control, are experts, they know what they're talking about, they're pooling all the information coming in from Europe. And if they would all follow that single recommendation, then at least citizens would have some indication, there would be some logic. The problem is that because public health has so far not been an area where the European Union had many competences, you can see that ministers of public health are very protective of their own powers and their own prerogatives. But I would say, and this is what the entire European Parliament has said, isn't it much more important that we give freedom back to the citizens, that we think about how can we allow them to travel again? And of course, it will be completely safe if they all would follow, if all the member states would follow this single recommendation by the ECDC.
Okay, and Monika, would you like to come in on that?
Yeah, thank you very much. Indeed, we are in the finalization, or the Council is in the finalization of the negotiations on this recommendation. And I understand that there is broad support for waiving restrictions for vaccinated and recovery certificate holders. And we would, of course, and if the process is going smoothly, as I would expect it, this recommendation could be adopted next week. So we hope, of course, while knowing that it is a recommendation, we nevertheless have 27 member states around the table, and we expect and hope that this common agreement will then also be implemented in practice.
Okay, and I'm just going to come back to some questions as we're getting a lot of engagement on this panel discussion. So, Minister, this might be one for you as well. It's a question from the Dublin Airport Authority. So, which entity should ideally take? Sorry, my friend up there. Which entity should ideally take responsibility for the checking of the digital EU the EU digital COVID certificate? An airline, a pre-departure or border management unit on arrival, as the cert is currently not a mandatory travel document. Can an airline deny intra-EU travel if a passenger does not possess one? So I suppose it's asking about whether it's mandatory, and I suppose which entity is taking responsibility for it in the airport.
Yeah, so I think this is a really important question, because again, I can issue these certificates to people, but what is the passenger journey? Like, what happens in practice when you show up at an airport with this? There have to be pre-departure checks, because you can't be sending people home routinely for showing up with the wrong piece of paper at the other end. So that has to be done at boarding, and then at the other end, then there has to be somebody who's checking. There has to be border control who are checking the certs at the other end as well. So you do require two levels of checking, and it also draws attention to the fact that that it is complex, because you have the health department of your country interacting with the airport authority, interacting with the airlines, and interacting with border control, which is, I mean, it is a complex thing to set up. But in fact, what is happening at the moment is something similar, but much less efficient, where people are trying to check negative PCR tests. There is an infrastructure for that. They are looking at things. They're trying to validate them. They're ringing phone numbers on them. So there is an existing system, and it's really just a more efficient version of that.
Okay, and Deirdre, Clune, I just saw you put your hand up there. Do you want to come in on this?
Just a quick point on that. The Minister's saying, I mean, I think, like, if I'm flying from Dublin to Brussels now, okay, I will be I will have to cross the border to get into Brussels, in Belgium, in the airport in Belgium. But normally, if you're flying from Amsterdam, which I would do too, through Amsterdam into Brussels, there is no checks. It's free movement. There is no checks. There's no facility to check. There's no scanning procedure. There will be no border control at all, because free movement within Europe. It's only because for Ireland, we're in the Schengen, we're outside Ireland, that we do have the checks. So I would think, just to do the GAA question there, that it'll be the checks will have to be at the departure. Will have to be the departure for most European airlines. But in Ireland, we will be going through a second check in the European airport that we arrive in. So,
I think.
Sorry, Minister. Just come back on clarity. Like, which entity will, or do you know which entity will be, I suppose, overseeing this in the airport?
So, at departure.
At departure, for people arriving, travelling out, who will be overseeing this?
So what's envisaged at the moment is that it is at check-in. So it is the airline at check-in who will be checking. But as Monika said, the Council of Ministers is evolving policy rapidly, and it is a changing situation. It's also a changing situation of reducing risk all the time. So every week in Ireland, we're vaccinating 250,000. 300,000 people are getting a vaccine, and the same across Europe at that rate. So the R number is reducing across, the risk is reducing, and at the same time, then we have this danger that another variant could emerge somewhere that could interrupt all of that. So it's an evolving situation very rapidly, rules are changing, policy is changing, and it's difficult to keep up.
Okay, and Billy Kelleher, I know you have to unfortunately leave us very soon. But just on that point, I suppose it has come up a lot in the discussions that I suppose national governments, they're keen to protect the health competency and be able to reimpose restrictions. But that surely is understandable, given that they're managing the situation on the ground and need to have that latitude to be able to respond to the crisis as things evolve.
Yes, well, I've no difficulty with member states having an entitlement to respond, and it's their duty to respond to a health crisis. But it should be benchmarked on the same uniformity across the European Union. So we should use the benchmark of the European Centre for Disease Control. That would be my observations on it. Otherwise, very quickly, you could have different views of what is an epidemiological difficulty in a country, but that another country may have a different interpretation of that. So very quickly, you could have massive fragmentation of this concept of free movement of people. So I would be very, very hopeful, or requesting at the very least, that member states would assess the epidemiological situations in their own countries based on the European Centre for Disease Control. And at least that would be a benchmark that every citizen and entity could base themselves on then. Otherwise, look, we will have that challenge. But I think that, look, there will be teething problems. There will be significant challenges when people go to other countries. There may be changes in terms of the testing procedures. That is all a risk. But if we had at least a template on what governments and health authorities will base their assessment of risk on a uniformity across the European Union, that would be a good start at the very least.
Template. Okay, and how can we achieve that? Maybe Sophie, I'll bring that to you since you've been following negotiations. How can we achieve a template that I suppose all EU member states can agree to, so that we can see a unified approach across all EU member states?
Well, it's not that difficult. All it takes is political will. They have already taken a decision last year, October, as I said, to all work on the basis of the same color-coded map, and then in practice they don't. So, as I said, all it takes is a decision, and then member states sticking to that decision. That's all it takes. So, but the point is that they've turned it into a kind of power battle between the national level and the European level, and then there's some member states like Germany, for example, which is a federal country, or Sweden, where the local authorities are very important powers in the area.
Yeah,
and that's also been they have also been arguing, which meant a delay in the introduction of the certificate. But I think those things shouldn't come into it. We have a fundamental right to freedom of movement in the European Union, and it is being impeded, not so much by the virus, but very much by the disagreement between the member states. It's not necessary. So I hope that if indeed next week they are going to, as it were, renew that decision, renew that recommendation, that this time they will actually follow it and ease the travel for people in summer. Because I think, apart from work travel and family travel, I think people really, really deserve a break.
I'd say a lot of tourism and hospitality sectors will be delighted to hear you say that. Okay, I'm going to quick fire through as many questions as I can, as I have so many here, and I'm conscious that people have tuned in and they want to hear from our panel here. So if I can start maybe with Monika, you might be able to respond to this question. So if we just keep the answers brief, and I'll be able to get through as many as I can. So starting a role in Luxembourg with EU institutions in September, congratulations. Was hoping to be able to fly home each weekend in the initial couple of months before relocation due to family commitments. Is this feasible, do you think? So Monika, that's a question for you.
Sorry, I didn't understand. So whether you will be able to travel within the Union again?
Yes, so this is an Irish person or somebody living in Ireland, or an Irish person starting a role in Luxembourg with EU institutions in September. So they're starting a job in Luxembourg, and they were hoping to be able to fly home each weekend for the initial couple of months. So initially, fly home every weekend due to family commitments. Is this feasible, do you think?
Will also depend a lot from on the Irish authorities, because as far as Luxembourg are concerned, there are no restrictions. except for taking a test, I think, if you fly in. But as said, also the epidemiological situation is improving. So I can only appeal to member states, if this recommendation is approved next week, to, as Mrs. Inetfeld said, to apply the recommendation as member states all agreed upon. So, and that would mean that for these green and orange regions, only a test, for green regions, no restrictions at all. And for orange and red regions, only a test would be required. That indeed would then allow it to travel back and forth.
So it might just be a PCR test to be able to enable them to come back.
Yeah, and perhaps just please always have a look at Reopen EU, the website that has been established for this precise purpose, and it is available in all languages. That I wanted to say as well, so that people really can find the information they need.
So Reopen EU, if you're traveling, that is where you need to go. Okay, Minister, I'm just going to bring you in again. I have a question here from a Canadian student in Ireland. I'm a non-EU student studying in Ireland and might go back to Canada for the summer. I'm fully vaccinated from the HSC, have my vaccination card from them. Would I be eligible to use the COVID certificate? So they're Canadian but living in Ireland. And if you're out of the country, is it possible to obtain this certificate? So say if she's in Canada, he or she is in Canada and need a certificate. And will I need the certificate to re-enter Ireland? So 3 questions there.
Yeah. So the first question is the issue of certificates to non-citizens. So I think I referred to that, but you're on holiday somewhere, you need a certificate. So it's certainly we're going to have to find a way to do that. The other question I think is that they're back in Canada, and will they need to get will they need a digital COVID certificate to come from Canada to Ireland?
Exactly.
And yeah. So these certificates are it's an EU travel mechanism, and people are going to arrive into the EU from outside the EU, and they're not going to have digital COVID certificates. They're going to have something else. And there were other international similar operations or attempts at projects to come up with mutually recognized certificates going on. I think the WHO has one, and IATA or somebody. I think there are these people
working on one.
Yeah. So in practice, in an airport, we're going to have to admit people who don't have a COVID certificate because they came from outside of the EU. So who have, who arrive with something else, with some piece of paper. So
this person's vaccinated. So yeah. So probably
it's not exactly. So it's not a silver bullet that everybody at the airport is arriving with these EU COVID certificates. There's going to be a lot of people who don't have them, and they're going to have to be processed as they are processed now. And what the rules will be for entry to Ireland from Canada in a couple of months' time it's impossible for me to predict. But I do know, for example, that if you're vaccinated, this person is vaccinated. Yeah, if you're vaccinated, you can skip hotel quarantine.
Yeah, and they have their certificate.
Yeah.
Okay, thank you for that, Minister. Okay, Deirdre Clune, I'm going to come back to you. So these are some, I'm tongue-tied. These are some specific questions from different people about how exactly the certificate will work. So maybe you can help shed some light on it. So if a child has to be tested within 72 hours of travel and they do not have a mobile phone, then the certificate will hardly arrive by post within the time frame. So they're just concerned about the time frame and the turnaround, particularly if a weekend is involved. So maybe if they get tested on the Friday or a Thursday and, you have the Saturday and Sunday, will a parent be allowed to show multiple digital versions from their phone? So basically, I think that they're concerned that the child mightn't have, might get tested later in the week in the turnaround, and then will a parent, I suppose, be able to show digital versions on their phone? Surely a parent will be able to, for a child, will be able to represent them.
Yeah, they will. That's right. And you can always get a paper search anyway. There's a paper option available as well. So
so that should be fine.
But you've 72 hours. I know it's difficult that turnaround. 72 hours to make sure you get the test in time. To give it 24 hours and maybe a little plus to get the results, and then you have to have it for landing. It has to be 72 hours for landing, not even from takeoff. So it's you need to put a bit of thought into it. But all the test centres are available over the weekend now. Unfortunately, they'll be paying for them.
So they can, So you can go and avail of a test every weekend. Yeah. So you should be able to have 72 hours. Yeah. Another question, actually, the Minister might be best placed to answer this, and I know we touched on it earlier, but I understand Irish residents can travel from the 19th of July, but when will they be able to apply for the certificate here? So it's if you're vaccinated, you'll receive an email from the HSE. Obviously, if you have recovered from COVID, are you going to receive an email from the HSE? So someone's just wondering, if you're going to book a flight, when will you be able to apply for this certificate or receive this certificate?
All right. So in other words, the answer to that is before the 19th of July. So I don't know exactly what date they're going to be issued, but they are going to be issued in time.
Okay. Okay, thank you, Minister. And question 3, who will be responsible for what in Ireland regarding the issuing of COVID certificate agency, and will it be manage the process of issuing the document? So we've touched on that earlier. The HSE will oversee it. They will email you if you've been vaccinated, or if you've recovered from COVID, you should receive it before the 19th of July. Actually, Minister, just to come back to you, for those who haven't been vaccinated, I suppose their 2 avenues are you either receive a PCR test, or I suppose if you haven't been vaccinated. So, and then what if you've recovered from COVID in terms of antibodies? What's their status there if you've recovered from COVID? How will the HSE also notify them, give them a COVID certificate?
So we estimate, like from our COVID testing system in Ireland, we estimate that we have 250,000 people that we can identify as people who previously tested positive for COVID but have since recovered. And so we're in a position to issue those. Is your question about serology tests and having an antibody test on people who may have the antibodies for whatever reason?
Yes, just to prove. So essentially, if you've recovered from COVID, you're proof that, I suppose, that you've had COVID within the nine months. What will be, I suppose, the correct criteria in order to be able to prove that?
So I guess if we have tested you in the last 9 months and you've tested positive, if the HSE has tested you and you've tested positive, and the appropriate amount of time, there's a number of days afterwards that's counted as the recovery period, then they will email you and offer you a recovery certificate. There is a list of approved. There is also a possibility of antibody tests or serology tests, and there's a list of approved tests and a list of approved antigen tests, and that the EU has defined a list of particular types of tests which can be included on the certificate. And so any country that's accepting those tests as admittance for their country, you can get that on your certificate.
Okay, thank you very much, Minister. Well, we're coming to the end of our session. I'm going to put my last question to Sophie. I suppose we've got into a lot of the technicalities, and I hope a lot of our attendees and guests got a better sense of how this, I suppose, system is going to work, and hopefully everybody will be able to fly again and have a good experience, and that this will be a great success. But Sophie, I suppose, how important is this from an economic perspective in terms of the recovery of the EU economy? Maybe if we can just finish on that.
Well, I think very important. Of course, this is not the only element. Fortunately, the European economy doesn't depend exclusively on the introduction of this certificate, but it's going to help a lot. First of all, because the tourism season is starting, and many countries, in particular in the south of Europe, really need tourism. And secondly, there are a lot of people who are working and living across the border. Just think of the transport sectors, and of course they've created these green lanes and what have you, but there's still a lot of obstacles, and that is going to be a lot easier. But in the end, I think this is not just about the economy. This is also about the right of people, the right to free movement, but also the right to family reunification. The right even to, you might even say, to mental health, because I think what I just said, we all need a break. That's very serious. I sometimes hear people say, oh, but this is only for people who want to go on holidays. It's a luxury. Well, I think particularly for people who may have lost their jobs or their income, who've spent a year and a half cooped up in a small apartment with lots of kids. I think for their mental health, they desperately need a break and a change of scenery and to take a breath. So I think it's important for our economy, but it's also extremely important for our collective well-being, I think.
Okay, and on that note, I will finish there. Thank you very much to Monika, to the Minister Ossian Smyth, to Sophie, And to Deirdre, we are very grateful for the seminar, and I hope it's given the guests and attendees a better insight into what they can expect from the 1st of July for the EU rollout of the EU digital COVID certificate, and from the 19th of July here in Ireland. So thank you very much from Dublin.